Well, hello all of you. I introduce myself. I am Dr. Fayan Perez Rivera, plastic surgeon from Buenos Aires, Argentina. This is the title of my lecture. I want to talk about the way I act with this radiofrequency platform with transdermal, microneedle, and fractional handpiece, my indication and my results. My conflict of interests. First facts, skin aging process. That's happening right now over you and over my face. It's estimated that the collagen content of the dermis decrease 100% per year throughout adult life. That's why we need to do something to solve it, to fix it. One of the ways to act is by laser, but you know that is the second fact. The laser over dark skin, like fixed value 3, 4, 5, and 6, have a higher risk of PIH after the laser treatment. That's why we need to look for safer and more gentle treatment as the wave frequency. By the wave frequency, we can reach the temperature over the deep layer of the skin to 52 to 55 centigrades, while the surface of the skin and the epidermis don't increase more than 40 to 42. That's why we obtain a great heat over the inside the dermis, and we obtain the rejuvenation and the stimulation of the collagen cells without increase too much the temperature over the surface of the skin. That's why we can avoid complication and burn as PIH. At the moment we send energy, we send heat to the skin, start two different ways to act. The first one, the immediate effect, we obtain a collagen contraction. I love this example. If you put a beef on the barbecue, in the size of this beef is going to decrease. Why? Because the heat obtain a contraction of these muscle fibers, collagen fibers, etc. But at the same time, we obtain a long-term effect. It's a modulation, a collagen remodeling. But the two ways finally reach to the same goal: skin tightening and wrinkle reduction. We have different kind of goals, depends on the different kind of layer that we want to act. If we act to the surface, to the epidermis, we look for rejuvenation. If we act in the middle of the dermis, we obtain the contraction, the tightening. But if we act in the deeper part of the dermis and directly to the hypodermis, we look for the fat cells to induce to the apoptosis, to induce to the reduction of the fat cells. That's why we obtain a contouring. These are the other two facts when you talk about wave frequency. The wave frequency penetrate the deeper part of the skin, looking for not color depends, only looking for the impedance of the tissues content. It means it's this impedance is the way that different tissues act to the pass of the energy through it, while the epidermis and the hypodermis have a great resistance to the pass of different kinds of energy. It's not the same in the dermis. It's a low resistance. That's why it's the way and the part of the skin we want to act. The other important part is by this energy, when change the energy to heat over the skin, we create this stimulation of the fibroblasts to create more collagen cells, for example. And the other part to act is by the heat, we obtain the reduction of these cells. It means contraction. These are the typical skin type of my idols, my sport idols of my country, and it's a worry about me about the situation after laser treatment, because usually that skin obtain PIH after any kind of laser treatment. That's why I usually, if I want to sleep well, if I want to avoid any cold during the weekend, I choose wave frequency treatments. Finally, in summary, all skin type every month of the year. These are the best goal when you talk about wave frequency treatments. I have two devices, two platforms to choose when I decide to build this kind of wave frequency platform. I choose the um, Pro platform, and I have to choose between 7 types of handpiece. I decide to buy 5 of them. The fractional treatment handpiece, like intensive FSR, the focused wave frequency, I choose the mini shaper. And when we talk about tightening and contouring, I decide to both high fine and contour. These are all the versatility treatment indication that we have when you use a wave frequency platform. For example, we can obtain improve and reduction of wrinkle, skin tightening, reduction of facial fall, improving the stria and scar keloid treatment, never disappear, but always improvement, improving the skin laxity, reduction of cellulite, local obesity, destruction of some kind of glands, and that's why we can be successful in the treatment of hyperhidrosis, osteohidrosis, reduction of acne sequelae scar. I want to mention what's mean for me wave frequency blepharoplasty, and finally the concept of delivery drug device. When we want to start with transdermal wave frequency, and as a plastic surgeon, I prefer to have problem during my surgery and at the surgery room, not at my office. That's why I look for safe treatment. In which way this handpiece, transdermal wave frequency handpiece, give me safe solutions? By 3 ways. The first one, have a motion sensors. It means that if our handpiece don't sense that we are in complete movement, they stop to send energy. By this way, we avoid any kind of hot spots, hot dots. That's why we avoid burns. The second one, we have a tissue contact sensor. It means that if the handpiece don't sense that they have a complete in touch and in with the skin, avoiding to be in the side of the handpiece, we avoid this again hotspot, and we avoid again any kind of possibility of burn. And the last one, the real-time impedance. That means the handpiece sends in the real time the energy we send to the skin. And if they sense the difference between the parameter that I choose, they can reach or reduce the amount of energy to be sure apply only the power that I choose for send to this part of the face or the body. The last way to be sure we can avoid any kind of problem depends on the handpiece I choose, depends on the deep penetration that I can reach. For example, if I use the high fine handpiece, I can reach only 1.5 millimeters of depth. That's why it's very successful over the highlights on the periorbital area, because the thicker of the eyelids is only 1.5, no more, no less. Different on opposite to the contour handpiece, can reach 26 millimeters of depth. That's why we can reach directly to the fat cell and look for the reduction of it, look trying to reach the apoptosis, the suicide of the fat cells by these wave frequency devices. All the wave frequency are the same? No, not at all. We have a monopolar wave frequency. That means we can have low selectivity but very deep penetration, opposite of the classical bipolar wave frequency that we have great specificity but really low penetration. We can't reach to the all deep of the layer of the skin. Bipolar, multipolar wave frequency is like similar like the typical bipolar, but when we talk about 3D type of wave frequency, it means we can reach all the layer of the skin with the bipolar type of wave frequency. Why? Because we have 3 positive poles looking 3 negative poles all at the same time. That's produce a reject, a repel of each arc of energy, and that's why we can reach to all the figure of the skin. Here is the gain, the situation you can see in this drawing, and by this video you can see the way that we send the energy, we create this arc repel each other, and we can reach all the layer of the skin, and for example obtain this contraction of the collagen cell. In this other view, in this other video, you can see the way we create a great balloon of energy, and when it starts to repel the arc, this balloon going down and as again can reach all the layer of the skin. If you believe in your device, you are the one to test it, like me. And the first time I bought this device, I was the first patient. Here I am, and look that with the thermometer, we can be sure we can reach the ideal endpoint of temperature to create this collagen cell. Is between 39 to 42, no less, no more. This is the ideal endpoint temperature to create this more collagen cell inside the skin. When you compare with this Telmar photography between the typical bipolar penetration to compare with the 3D type of bipolar device, while the first one can reach only to 1.5 millimeters of deep, the second one can reach up to 6. This is because you have the 3D type of send the energy. And in the video, you can see the same by movement, and you can see the way we can reach the deep layer of the skin. We start mention one of the devices, one of the handpiece is the mini shaper, and help us to measure well and to understand well the way it acts. Here in the center we have this cycle is the negative pole, and these other 3 arc or cycles of positive pole. They act at the same time, looking the same, only one negative pole. That's why they repel from each other and obtain a deeper penetration. For example, to obtain this kind of result, a young lady close to the 40, I can offer her, for example, a filler, hyaluronic acid filler, to reduce the size of this sulcus, of this nasolabial fold. But we decide to use heat to obtain a contraction in the middle of the cheek and obtain this improve over this fold, as you can see here in this half profile view. And again, over this patient close to the 40, in this front view, you can see nothing at all as me, but we put that in a vector system, and you can see the great quantity of yellow arrow. It means the volume we can obtain will be increased, and the direction of this volume was increased. It means that we obtain more remodeling of this collagen cells over this patient. Other part of the face and the body we can act, for example, is the inner part of the thighs. And by the heat, we can obtain the reduction, the permanent reduction by the apoptosis of this fat cell, and obtain this great result with only 6 sessions, 3 passes, with this amount of energy with the mini shaper. The concept of Endymed, it means when you apply different kind of wave frequency in the periorbital area to get improved to the eyelids. I always say that 2 is better than 1, 3 is better than 2. That means I can choose only one of these wave frequency as high fine, FSR, or intensive, or you can combine 2 or 3 of them. I'm going to show you some of my results with this kind of combination. Again, I was the first patient with the iFine, and you can see here the endpoint is only weaknesses in the area after 3 or 4 passes. To obtain this kind of result, for sure, in these younger ladies, I can obtain better result using a CO2, for example, and I can erase all these wrinkles. But with a prolonged PIH and prolonged erythema, it's not the situation when you choose wave frequency high fine. You obtain only slight erythema for less than 2 or 3 hours, and you can obtain this better quality of skin and better reduction of the wrinkles only by this device. Or this patient have a complete indication for a surgery procedure. Is a friend of mine. She have blepharochalasis, eyelid bags, lagophthalmus, and I decided to perform a surgery because I am a plastic surgeon. And this is my result over here. But if you can see here, I still have these crossfit wrinkles in the lateral part of the orbital area. That's why I decided to apply high fine during the post-treatment recovery time. And here is the best result I can obtain combine surgery procedure and wave frequency procedure after the surgery. This is not a patient of mine, but it's important to mention that the feston, a tricky situation over the malar area, is mean a difficult drain of the lymphatic system can be solved by heat, can be solved by the high fine. That's why I show you that as a result. When we talk to get improvement in the body, we need to choose, for example, the contour handpiece. We can act over the abdominal area, flanks, buttock, and thighs. It's important that we need to decide area to treat of 15 centimeters square in each session, no more than that, to be successful. And as I mentioned, we can reach 26 milliliters of penetration. That's why we can reach not only the skin, we can reach the skin and fat cell to induce it to the apoptosis, obtaining a final reduction, a complete reduction of this fat cell, and get improved in the size and the contour of this area in which we are to act. And here again, this is me during the first treatment with this device in my abdominal area. And this is one of the results that I can obtain with this combination. As I mentioned, 2 is better than 1. That's why in some cases I add to the contour treatment the mini shaper 2. This is my parameters. This is what I did over this patient to obtain this great reduction in this back part of the tights. Some cases, another colleague sent me this photo and asked me for solutions to some kind of side effects. It means panacolitis. Don't be afraid if this happens over your patient. Panacolitis is a not infection situation in which one the fat cells getting harder before to start to the apoptosis. It's only a step before going to die, and you need to do nothing, only to wait or take some anti-inflammatory pills to get in a little more comfortable way to your patient. But it's not a great problem. It's only part of the way that our fat cell notice us that is going to be disappear. And here is me in the video when I obtained this panniculitis with another device, another wave frequency device you can see my finger going down without any problem. And over there, we have a stop because it's getting harnessed. It was by the wave frequency. And as I mentioned, this panel colitis is going to solve by itself. I'm going to start to talk about the fractional handpiece. I start with the FSR. It's really interesting handpiece because I have two ways to act. We can decide to perform only a slight ablation, 150 microns, or plus that, we can add a volumetric heating over all the thicker of the skin, 2.9 millimeters of depth. It means all the thicker the skin, for example, over the face. And I can do that by 112 pins in a total of 30 millimeters square of area of act. And as I said, I can choose between ablation, volumetric heating, or I combine both situations. For example, if I want to erase little wrinkle in the lower eyelid, I prefer to use more ablation than heating. But if I want to reduce the size or obtain a contraction in the upper eyelid, I prefer to choose more heating than ablation, or combine it, as I said. It's really interesting the way that this handpiece acts. In the same pulse, over these 14 columns, I change the situation of the negative pole over the 5 positive pole. It means it's going to jump, for example, in the first mini pulse inside the grid pulse between the first column to the 5th column, again, jump again to the 9th column, and jump again to the 14th column. By this way, we can be sure we can reach all the 14 column in homogeneous way and send the heating to all the surface lower these dots. In the video, we can see dots, ablation and volumetric heating at the same time. First, we apply the ablation, and the same pulse, you can see the way this heating going down and reach all the layer of the skin. And don't worry if you find out after the treatment, because it's our endpoint. If you can obtain this little dot of epidermolysis, you can be sure you obtain a good ablation of this 150 microns, and this is the way we can polish the surface of the skin, for example, to treat an stria or to treat a scar. And again, here I am, the model for this device. My assistant performed this ablation in my periorbital area. My results in a few minutes. Then we're going to start about the second fractional handpiece is the microneedle skin remodeling handpiece. It's mean intensive. By the heat, we can obtain skin contraction, skin tightening, skin lift, skin remodeling, fibroblast cell stimulation, improving the quality of the skin. But even all of that, by the heat, of course, Argentina can cook the best asado barbecue in the entire world. I invite you to visit my country to be sure that my words are no liar. Another way to obtain a safety treatment is the characteristic of the motor of this handpiece, because have a slow way to penetrate and with a great torque, with a great force. That's why we're sure our treatment is an unpainful treatment when you compare with another kind of microneedle handpiece. And these are the typical, this is the characteristic of our handpiece. It's a bipolar wave frequency through 25 microneedle. It's not the isolated needle of a total of 300 microns wide. They're gold plated and really super sharp. We can reach up to 5 millimeters, but the important is you can increase every 0.1 millimeters. That's what you can perform your own recipe of the treatment. You can choose the power duration, you can choose the deep, and you can choose the pulse durations. They have the possibility of a total of 1,000 pulse. The difference between non-isolated and isolated needles, in non-isolated needles, especially this one that is fractional, you can obtain uniform heat in all the length of the needle, and that's why you can reach more quantity of surface of the skin in only one pulse. And by the fractional weight, it means little pulse inside the great pulse, you can obtain a great volume of heat in the surrounding tissues of the needle. That was, for example, for when you talk about hyperhidrosis, we can reach more quantity of sweat glands, and you can destroy it, and you can obtain a better result in the reduction of the sweat. Again, it's only a matter of impedance. It means the resistance of our tissue to the pass of any kind of energy. While we have a great or high resistance on the surface, on the epidermis and on the hypodermis, you have a low resistance of the dermis. That's why our energy flew through the dermis without any problem, and that's why this is the area we can obtain the great goal of this treatment, of the microneedle wave frequency treatments. And I love to use this example. It's like cars on the high-speed train. Maybe you can see only the high-speed train pass through you, but inside of it you have a little scar. In this video you can see the way so you can see the penetration of the needle, but at the same time you can see this great volume of energy, because these little pulses summer each other to obtain a great volume of heat. I was invited as a faculty guest in INCAS World Congress 2022. Between this conference, I have the opportunity to walk away through the corridor and look for another good session that was interesting for me. I saw this title, Microneedle Wave Frequency. I said this is the important session for me. The chairman was Fadi Hamadani from Palestine and Serge Dahan from France. I don't know if you know this guy. Joseph Lefter is the one in charge of the medical department of the Endymed, and this guy, Hugh Cartier, is a friend of mine and is the one in charge of all the scientific program of all the IMCAS Congress. For my surprise, the first patient that Serge Dahan showed to all the audience was a patient treated by me. I'm going to show you in a few minutes. And the second case was another case of mine. I'm going to show you again the patient and the parameters that I choose. When you talk about cervical skin laxity and jawline, I use the microneedle by this way. Look at my not able hand pinch the skin to be sure we can reach the deep that I choose of my needle. If I don't doing that, maybe the needle can reject when touch the bone. That's why it's not so safe treatment. That's why my first clue is to pinch the skin when you treat this area to obtain this kind of result. For example, in the front view, you can see nothing at all. I can neither say so any kind of result, but in the profile view, you can see a great change in the angle on the neck in this young lady, over close to 140 degrees in this angle, change to this 110 degrees in the angle of this angle between the neck and the face. And this was made by the contraction of the skin. Again, difficult case, a patient with a heavy and fatty neck, I first apply a diodo laser and then take out excessive fat cell with a cannula, but appear excessive skin and this a lot of folds and laxity in the skin of the neck. That's why then after that I apply the microneedle with this parameter and I can reach this great contraction of the skin. Or this another patient in which one the jawline disappear by the fat cells and by the laxity of the skin. First, as I mentioned, I applied a diodo laser and take out excessive skin, excessive fat with a cannula. And after that, I applied the microneedle to obtain this great contraction. And again, this jawline appear. The same patient, but right now in a vector system view to give you the possibility to measure well the previous situation. The jawline disappear and you have no great definition of the neck. The jawline appear and a better well situation of the neck, and the final situation after you apply the microneedle with the recontraction over the jawline and over the neck. When I combine these two treatments, FSR and intensive, I can show you the way I treated in this perimeter area. My not able hand, my right hand, lift the eyebrow to be sure the application of the FSR is only over the bone to avoid any injury on the eyes. And after the first pass with the FSR, I apply the microneedle in the same area again using my not able hand, the left hand, my right hand, lift the eyebrow, I can apply the microneedle over the area of the skin that have the bone behind him. To obtain this result, I'm going to give you a close view to measure well the way I can obtain again the sulcus in the left, in the right eyebrow, upper eyelids, and obtain the reduction between 3 wrinkles to only 1 in the left upper eyelids. After filtration, the same situation. This is a patient of mine. I performed a facelift, chin implant, and rhinomodulation. Maybe in the profile view, you can see it was successful. In the half pro view, you can see and think in the same way. But in the front view, I need to say that I was not good enough. I leave too much excessive skin in the upper eyelids. I have 2 ways to solve it. That first, go again to the surgery room or applying technology. And this is the situation after 3 treatments and 4 sessions with intensive and FSR combination. And this is the quality of the skin and the quality of the contraction I can obtain only with this treatment, and give me the possibility to avoid return to the surgery room to solve this problem. Young lady, a model, and she requests me to give her solution to these little wrinkles, but without a prolonged PIH and without a prolonged erythema, as I can obtain with the laser. That's why this is our situation after 2 sessions of the combination of FSR and intensive. And look here in the profile view, the same good result in which one you can see the reduction, the rate of these wrinkles. And the patient over 70 that don't have any indication for surgery because she performed a plastic surgery in the past, a facelift in the past, but we need to act for the quality of the skin. Look the way we can reduce the wrinkles in the area and over the crossfit area. And at the same time, with the slow ablation we can obtain with the FSR, we can erase the lentigos because are surface pigmental lesion, and we can reduce at the same time with this device. Not only reduction of the wrinkle, at the same time we can obtain an ablation or little pigmental lesion on the surface. When we talk about acne sequelae treatment, this is the patient that Sergei Dahan showed us during the INCAS meeting. And I'm going to show you the 3 different views. This is the front view, the lower view, and the best one, the half profile view, to measure well the way I can obtain a great reduction of this acne scar sequelae. And this, I showed that to my patient to give him calm when they choose this treatment for the reduction of acne sequelae scar. This is the situation after only 4 hours when you finish the treatment, and this is the redness that I leave on the face. But look the patient after complete 24 hours with little redness, and she can return normally to her regular work and regular social activity without any problem. When we talk about FSR and intensive complication, we need to talk about that. This is a complication of mine, and here is the problem. I perform a lot of stacks. Stack means you leave the handpiece, FSR or intensive, in the same place and shot several times. When you get the skills using this device, maybe you can perform 1 or 2 stacks, but never 4 is too much. And this is the proof of that, because I obtained this kind of lesion in the lower eyelids and in the upper eyelids of these young male patients. But I put in contact with him during the post-treatment recovery time, give some clue to solve it. I was surprised from him in the last INCAS America 2023. He gave me a great hug and give me the thanks, because he was really happy with the result, and all this mark disappear. And this is another complication of mine. Again, a lot of stacks. In this case, was 4 stacks with a microneedle radio frequency handpiece, the intensive handpiece, and I obtained this PIH. Nowadays is still in progress. I indicate some inhibitor of melanization, and I use the Q-switch laser to reduce these pigmental lesions. When you talk about skin laxity and fibrosis, this is the other patient that Sergei Dahan showed to the audience during INCAS Congress. You can see here in the profile view, it's a great result. In the front view, it's a great result too, but if you made a close-up of the navel, here is a lot of laxity, fibrosis, and excessive skin that we need to solve it, and I solve it by this treatment with microneedle. After 4 sessions, this is the situation that I can offer to my patient, and she's really happy with the result. Here is another complication after a liposuction by me, excessive skin over the navel. Okay, and here is the way I can solve it, only using this microneedle device. And here is again, we can compare in the same position, the same fold, and the way I contain this contraction of the skin and solve the situation, and give me the possibility again to don't return to the surgery room to solve it. Scar and keloid is only by improvement. Don't look for a complete erase. Here I'm acting with a scar in the mastoplasty surgery. We can obtain a little ablation of the surface. By this way, we can polish this scar and get more smoothly appearance of this mastoplasty. Or When you talk about the treatment of keloids, as you know, the keloids are pathologic scars that never stop to increase and have a lot of symptoms like pinch or something like that. We can reduce this situation first applying fluids or solution as corticosteroid and 5-FU. And after that, we apply the microneedle to allow these fluids this solution go deeper inside the keloids. And after several sessions, we can reach this situation. Remember that it's impossible to erase the scar, but it's possible to get improved in the quality of these keloids and give the possibility to stop the growing of it by this combination of solution and microneedle with the concept of delivery drug device. Or over the face of this young lady, 5 years old, have an accident. First, I apply a filler, hyaluronic acid, and after that, 3 sessions of FSR to polish the scar and give her this actual situation of the scar. Another case, I'm going to take the color of the photo to measure well the way first we apply a filler, hyaluronic acid, and then we polish the scar with the FSR. This patient looked for me for tattoo removal. That was I did. After we finished the treatment, it's really common to appear a little PIH or a little phantom of the previous tattoo. It's all a matter of time, but the patient get nervous, anxious, and look for another colleague to take out the skin and leave this scar. And again, return to my appointment, look for a new solution to polish this scar and give him a better quality of the skin. First, we apply this silicone shed, and after that, we start the treatment with the FSR, trying to, again, to reduce the image of this scar. And after several sessions, this is the actual situation of the scar, is with better quality of skin. When you talk about stria, remember that nothing in the medicine can reduce or can give a complete solution, but we can at least give a better view of the skin and try to simulate this stria, for example, in this mastopexy. When we talk about the treatment of stria and scar, remember that it's impossible to erase, but we can get it a little improved, like you can see here in the picture. There's a lot of published articles talking about that. I mentioned few of them, but especially this one, because they prove that by biopsies before and after the treatment, in all the cases, they obtain a significant increase in collagen, elastin, pigmentation, and vascularization of the scar tissue made by this microneedle treatment. That's why it's for sure, it is true, you can get improved in the quality of any kind of scar using this device. The final topic is the treatment of hyperhidrosis and osmidrosis, and I can do it by microneedle. In which way? First, the less hygienic celebrity. If you put this phrase over the media or your cell phone or by internet, you can find this embarrassing moment of people from sport, actors, even people from royalty who pass through this embarrassing moment. And this is really difficult because a majority of the people compare and think that these patients are really lack of hygienic and lack of take care by himself and by his image, and nothing is far from reality because they are really concerned about that and they need and look for a solution. First, I give you the definition of hyperhidrosis. It's excessive sweating that occurs spontaneously without being caused by high temperatures or by situation of physical or emotional stress and whose chronicity interferes with normal work and social activity. But in summary, is sweating without any stimulus, without any reasons. We have two different kinds of sweat glands. The first one, the echinal ones, is the one to produce the majority of the liquid. 90% of the sweat is produced by itself, by this gland, sorry. The other ones are the apocrine glands, and they are responsible to create the ceramide that lubricate the hair and the skin. Hyperhidrosis typically is symmetrical and begins in adolescence, but look this number. 3 to 5% of all world population suffer with that. It means, for example, in my country, 2.5 million Argentines suffer with that. A majority of them don't know, that there's a solution for it. That's why we need to talk about that with our colleague to try to then understand. They need to give this message to the patients that there are solutions for the hyperhidrosis and omidrosis too. It appears more frequently in Asians, especially in Japanese. It's a family problem because it's hereditary. 50% of the cases is hereditary. That's why it's a problem for grandfather, father, son, and grandsons that they want to suffer about that in all their entire life. And majority of the cases are the axillary hyperhidrosis in 60% of the cases. Different of that is the osmidrosis or bromidrosis. It's caused by an excessive secretion of the apocrine glands. These ceramides, when you put in contact with the normal flora of bacteria in the armpits, start to oxidate and change it, start to create a great smell, a strong smell, and in some cases, it's not only the typical staphylococcus bacteria, at the same time appear corynebacterium and anaerobic bacteria that will, in some cases, the others will be getting worse. And there are genetic and acquired causes, but the more frequently are the genetic cause. This drawing is really important because while the echinal glands are inside the dermis, in the middle of the dermis, in the depth of 2.5 to 3.5 millimeters, majority of the apocrine glands are deeper, are between 3.0 to 4.0 millimeters of depth. That's why if you want to be successful in both kind of disease, hyperhidrosis and osmidrosis, you need at least a needle of 5 millimeters of length. That's why I choose this handpiece, I choose this device. When you talk about the tip of this microneedle device, you need to mention that it's bipolar wave frequency. You can choose the depth, you can choose the time of the pulse, and you can choose the intensity. But it's not selectivity. You try to create thermocoagulation, different dots in different layer of the skin to be sure to reach more quantity of sweat glands and destroy majority of them to obtain a permanent reduction of the hyperhidrosis or the osmidrosis too. There's only way to be objective with this treatment is by the minor test. It means to apply iodopovidone solution and then apply talcum powder, and you can obtain this kind of drawing, this sweating drawing. And you can do it before the treatment and after a month of the treatment to be sure you can obtain a reduction in this drawing. That's why you can be sure you were successful. And look that this is really weird. Same patient, different armpits, to notice that the drawing is not really always the same patient, but in one of the armpit, the drawing is more in the center of the armpit, and in the other armpits are more in the surrounded in the lateral part of the armpit. That's why you can choose different kind of parameters. Depends on the drawing. All this knowledge give me the possibility to publish this article in 2019 in the AJPS, European Journal of Plastic Surgery. During this day, I obtained 50% of reduction of sweating in 80% of the patient, but I still have 4% of complication as burn, scar, hyperpigmentation, and hypopigmentation. That's why during this year, I decided to still looking for a better device. This is a step by step the way I perform the treatment. First, as I mentioned, I apply the iodopodine solution on the armpits. Then I apply the talcum powder. After that, I take out that. After I notice the drawing, I apply antiseptic and perform the limit of my drawing. I apply lidocaine as anesthetic because it's a painful treatment. Without that, you can see here the microneedle that we use over the area. And when we finish the treatment, it's important to obtain this endpoint, this bruise, to be sure you send enough energy to be successful. These are my actual parameters. I use double or triple pass. I use stacking mode twice and use the higher power 25 and the higher pulse duration of 200 milliseconds. This is me during this Inca World Congress 2022 during a live demo of this patient. And as you can see here, I can reach exactly. As I mentioned during the presentation, if I can reach, I can use this way to send the energy by the penetration of the needle in a gentle way, soft way. I can reach the dip that I choose without any injury of the surface of the skin. This knowledge gives me the possibility to send several conferences about that. For example, in the ISAP Istanbul World Congress, it's a more important congress for plastic surgeons. And close to the end of my presentation, usually this is the typical post-treatment indication. Only ask to moisturize, use Vaseline, avoid the sun exposure for sure during the bruising, because if you're doing that, you obtain a PIH. Avoid extremous exercise for a week. If it's an osmosis problem, I say to my patient to combine not only the microneedle wave of frequency treatment, at the same time use chlorhexidine as an antiseptic to reduce the amount of corynebacterium and anaerobic bacteria, and by this way without obtain a reduction of the odor. As complication, I mentioned the one I obtained, but when you talk about specific about hyperhidrosis and osmosis, since I changed this new device, I have not had any permanent injuries during this treatment. The classical contraindications of any kind of radio frequency treatment as pacemaker, pregnancy, local infection, or history of keloids. And I encourage you to read this paper. Tana collaborator take the work to read all the papers with the keywords of microneedle wave frequency, and they found that a strong recommendation for skin rejuvenation, but at the same time for acne scar and axillary hyperhidrosis. That's why is you don't need to believe on me. You need to believe on the lecture that you're going to find talking about this procedure. There are new indications always we can find with this platform, because at the moment that you have platform, you have different kind of new treatment to exploring, as nowadays the treatment of rosacea. I don't have experience with that, but you can read this paper and trying with your patients. It's important to use devices, have a lot of certification in many countries to be sure it's a safe treatment. It's important to notice that there are different kind of publication on publication in different kind of journal talking about this treatment with this wave frequency platform, as you can see here and here. My final take-home message: I use daily on my office, not only the microneedle and the FSR, at the same time the transdermal handpiece. We use no less than 5 to 10, 7 patients every day. And all skin types, any season of the year, I never stop. Even in the middle of summer, I can perform this treatment, while my laser treatment need to stop during the summer. I avoid or minimize the possibility of PIH. This is one of the clues. Avoid complication of after the treatment is another clue. As I show you, 2 of my complications are going to disappear by itself. It helped me in some cases to improve my result of the surgery, and in some cases avoid to return to the surgery room to solve some of my surgical mistakes. There are many new radiofrequency treatment protocols, as I show you nowadays, the rosacea. And the ideal radiofrequency is a platform. Don't look for only microneedle, don't look only for transdermal, look for the one who can combine all these kind of radiofrequency, because as I show you, you can combine it and obtain better results. And for sure, in the near future, you can obtain more changes and more improvement in the software on the hardware of this device. Thank you so much for your attention, and I wait for see you in Poland, in Warsaw.
There is a question about dark spots and what is the protocol to treat dark spots and the pigmentation problems on the skin with Endymed.
Well, my experience treating lenticels when I treat the wrinkles over the face. As you know, lenticels, solar lenticels or zenith lenticels are epidermal lesions. That's why if you can erase that area with the FSR, made an ablation of 150 microns, I was able in 2, 3, or 4 sessions to erase this epidermis, and that's way I can erase the lenticle.
Okay, and the other question is about the hypohidrosis and how many treatments you have to do,
Yes.
and is it painful?
Okay, yes, it will be painful if you do nothing during the treatment or before the treatment. As I need to pass several times and use a lot of power and a pulse width prolonger, I need to make injection, lidocaine by injection as anesthetic, for sure. After that is unpaid for treatment. And my protocol is always 2 sessions is 1 treatment, every 15 to 30 days. And as I mentioned during the conference, I pass 2 or 3 times, but with the stacking mode. I leave the handpiece over the skin and shot 2 or 3 times in the same dot.
Okay, and there is a question about gel. What kind of gel you use?
The same gel that any kind of medical doctor use for ultrasound diagnosis.
There is a question where Endymed will be in Poland, so I think this is the question to the Bogdan.
Yeah,
I think it's
already here.
Okay, so there is another question. Is it enough for 1 week to avoid sun and ultraviolet after the treatment?
Well, good question. No. Even this treatment that we have low risk of PIH, even that you need to protect from the sun. You need to use the sunblock at least for 1 month to 3 months, as any kind of treatment or inflammatory reaction you produce to the skin. Of course, it's really less than laser treatment, but you need to be careful. This is important. That I have laser treatment since many years ago, 25 years ago. I have a quick switch, diodo, CO2. But for me, the summertime is something that I am really afraid to perform any kind of laser treatment because, of course, in this kind of color of skin, the risk of PIH is enormous. It's huge. That's why I think in another chance, another possibility, I look for a microneedle radiofrequency, and then I find platform. Well, not all microneedle. I have transdermal. I have FSR. Well, this is the one I need to buy. That's why I have it.
Okay. And there is another question. How long after the treatment we can do mesotherapy, needle mesotherapy?
Well, mesotherapy on the face, I think that you think about that or you talk about that. I guess, well, I give the recommendation on don't injure the skin after the treatment at least 1 month. Okay. The month is, for me, is a good period to don't hurt again the skin because injury, more ways to have anything. For example, the PIH.
Mm-hmm. Okay. Thank you very much.
Thank you for the invitation.
It was a pleasure.
It was a pleasure to be here. Bye bye.
Państwu dziękujemy bardzo za uwagę. Miłego wieczoru.